So, everybody's always saying how the unvaccinated are clogging up the hospitals. Oh, my God, you're so selfish that you're not vaccinated, you're getting sick, and now you're going to clog up the ICU when maybe a smoker needs it for a lung transplant, or an alcoholic needs it for a liver transplant, or a reckless driver needs it for a new left. There's many. Haven't you
people seen Squid Game?
Yeah. Or maybe an obese guy needs it for the thing. What? It's so that's what they want you to think. You're a bad person. You're selfish if you're unvaccinated, because you're going to clog up the ICUs, right? And this only happened because of COVID. And I keep saying, they cut 30,000 hospital beds in New York State in the last 20 years. Why aren't we adding more ICU capacity? We're 2 years into a goddamn pandemic, and they haven't added a goddamn ICU bed. And guess what I'm here to tell you? This is from 2018. Hospitals overwhelmed by flu patients are treating them intense. What? Come on. This is like 40 years ago. No, this is 2018. 2018. You mean one hospital, Jimmy? Was it in one part of the country? It certainly wasn't nationwide. It was back nationwide. You want to see it? In 2017, 2018, influenza epidemic is sending people to hospitals and urgent care centers in every state, and medical centers are responding with extraordinary measures. What? Like what? Well, they're asking the staff to work overtime. They're setting up triage tents, restricting friends and family visits, and canceling elective surgeries. Holy effing shit. Where have I heard this before? That's all I've been hearing. And it's your fault. It's your goddamn fault for getting sick. Isn't it funny? It wasn't any of these people's faults. Here we go. We are pretty much at capacity, and the volume is certainly different from previous flu seasons, said Dr. Alfred Talela, professor of chair of family medicine at the Robert Wood Johnson Medical Center in New Brunswick, New Jersey. Talia says his hospital is managing, but just barely, and keeping up with the increased number of sick patients in the last 3 weeks. The hospital's urgent care centers have also been inundated, and its outpatient clinics have no appointments available. This is a crisis. In 2018, guess what happened a year later? A frickin' pandemic, and they still haven't added an ICU bed. The story is similar in Alabama, which declared a state of emergency last week in response to the flu epidemic. Dr. Bernard Kamens, associate professor of infectious diseases at the University of Alabama at Birmingham, says that the UAB hospital canceled elective surgeries scheduled for Thursday and Friday of last week to make more beds available for flu patients. We had to treat patients in places where we normally wouldn't, like in recovery rooms, says Kamens. The emergency room was very crowded, both with sick patients who needed to be admitted and patients who just needed to be seen and given Tamiflu. In California, which has been particularly hard hit by this season's flu, several hospitals have set up large surge tents outside their emergency departments to accommodate and treat flu patients. Even then, the LA Times reported this week emergency departments had standing room only, and some patients had to be treated in hallways. The Lehigh Valley Health System in Allentown, Pennsylvania, set up similar surge tent in its parking lot on Monday in response to an increase in patients present. This was before COVID. This is the year before COVID. This wasn't 40 years ago. This was the year before COVID. Why don't they ever talk about this? Why doesn't Rachel Maddow or fake tough guy Lawrence O'Donnell or nerd Chris Hayes, who always lies, or why doesn't Sanjay Gupta talk about this? Or Jake Tapper or Don Lemon? They never mention this. You think they don't know this? And I do? Do you think they don't know this and I know this? They know this. They're not fucking telling you. The Lehigh Valley Health System in Allentown, Pennsylvania, set up a similar surge tent in its parking lot on Monday in response to an increase in patients presenting with various viral illnesses, including norovirus, respiratory syncytial virus, RSV, and the flu. Why didn't we shut down schools in 2018? Why didn't everybody have to wear a mask in 2018? The hospitals were overrun. Why didn't we have to have social distancing? Why did we have to do any of that? In 2018, didn't matter. But now we do. Why is that? In Fenton, Missouri, SMM Health St. Clair Hospital has opened its emergency overflow wing, as well as all outpatient centers and surgical holding centers to make more beds available for patients who need them.
I promised myself we'd never open this wing. Damn it. The day has come.
The day has come. Open the wing. Nurses are being pulled from floors to care for them, says registered nurse Jennifer Brzezinski, and are being offered an increased hourly rate to work above and beyond their normal schedules. Many nurses have also become sick, however, so the staff is also shorthanded. Where have I heard this before? The flu has especially affected hospital patients with other health issues. You mean other comorbidities? Says Brzezinski, who works with cardiac patients. Almost every patient in the hospital has the flu, and it's making their pre-existing conditions worse. How come they weren't selfish for not getting the flu vaccine? How come they didn't have to wear masks? How come they didn't have to quarantine? How come they... What in the F? How come you don't hear stories about, I had to make a decision between a cancer patient and a flu patient in the ICU? I had to make a horrible decision between my cardiac patient and a fucking flu person who we hate. More and more patients are needing mechanical ventilation due to respiratory failure from the flu and other rampant upper respiratory infections.
You should be doing Angry Harry Carey for this whole thing. Paradox.
So, why aren't there enough ICU beds? Well, I went and I found it's hard to find information for me anyway. I'm dumb. But I did find this. It says the paradox. This is from Health Innovation Journal, which. The paradox in our system is we have the wrong bed types. The U.S. has an abundance of medical and surgical beds and too few intensive care unit beds. Why would we have too few ICU beds? I bet it's because of, is it? Let's see. Well, because ICU beds are often unprofitable in a fee-for-service schema.
What schema do we have here?
What schema? What kind of a word is that?
We don't have Medicare. We have a national schema.
Schema. I don't think I've ever used that word in my life.
Jimmy, I just found this one statistic that I thought was interesting. In 1975, there were about 1.5 million hospital beds in the U.S.
Now there's less than a million, right?
Yes.
980?
919,000.
So there's way less hospital beds than there were in 1975, and you got to guess there's a lot more older, sick people now than there were in the...
Like the population hasn't been growing?
So back to this thing here. So why aren't there enough ICU beds? And here we are 3 years in a row. 3 years in a row, our ICUs are overwhelmed. In 2018, it was with regular flu. In 2019, 2020, it's the frickin' coronavirus. 2020, 2021. So 3 out of the last 4 years. Oh, I almost had 3 or 4. 3 out of the last 4 years, minor correction. So 2018, so it was 2017, 2018. So 2019 went mild. And then 2020 came back like a bitch. Our overall oversupply of bed belies the fact that we have less than half of the ICU and critical care beds that we are going to need in 2030. That's their prediction. So we're going to have to at least double the amount of ICU beds that we have right now by 2030. And here's something I'm going to cover on Wednesday. This is from ProPublica. ProPublica. Overwhelmed hospitals face a new crisis. Staffing firms are cutting their doctors' hours and pay. That's happening right now. I'll read you the subheadline and then we'll get to it Wednesday.
Because they haven't been working hard enough?
No kidding. It says multiple private equity. So I don't know if you know who runs our hospitals. Private equity firms do. And they run everything right at the margins for profit. There's no redundancy or backup. That's why there's not enough ICU beds, because they can't make enough money off them. It's no way to run a healthcare system.
Jimmy, healthcare is like diamonds, okay? It's they're not really scarce, but you have to have them scarce to increase value.
Yeah. Multiple private equity-backed staffing companies have cut hours for thousands of emergency room doctors, physician assistants, and nurse practitioners. That means there are fewer medical workers at a time in hospitals, and they are receiving less pay. That's from April 3rd, 2020. So we'll go back to that on Wednesday. But so when someone gives you that thing of, oh, everybody has to get vaccinated because our ICUs are overcrowded. Our ICUs are overcrowded because we let capitalists and hedge funds and private equity firms staff them, you fucking idiots. Because we live in the most corrupt country, I think, ever. We're the most propagandized country in the world. You think the problem is people getting sick, not that we don't have enough beds for them. How about now we're at 3 out of the last 4 fucking years. Our ICUs have been overwhelmed with people with corona, COVID, and flu. Overwhelmed. 3 out of the last 4 years nationwide, putting tents up, treating people in tents. And we're not adding one goddamn ICU bed. That's what we should be screaming about. Let's start taking the profit out of healthcare in the United States so we can actually have sane healthcare policies. Like maybe 2 years into a pandemic, we had ICU beds. Anything you want to add to this, Kurt?
I mean, if we could just get it down to... I'm willing to find a consensus where you can like just really jack up the drug prices, but just add a few beds to it.
How about you could add another $500 onto an EpiPen, but everybody gets an ICU bed.
Someone's going to have to be thrown into the volcano here. Okay? It's a big shit sandwich. Somebody's got to take a bite. Let it be these EpiPen pussies.
So was that Kurt? What was your reaction to this story when you first saw it? Did I send it to you, or is this the first time you saw it?
I think the private equity firm thing is like a bunch of people don't know what that is, or if they do know what it is, they're like, it's a very vague thing to a lot of people. But I always think of
just an investment
company. Want the government to run our healthcare? I'm like, no, I want a private equity firm to efficiently decide I should not get it.
I want a bunch of guys who are whose second job is to be the host of Shark Tank, running my healthcare.
I would like a corporation the size of a small government to run my healthcare for me.
Hey, come see a live Jimmy Dore show. We're in Los Angeles, January 7th and 14th. Then we're in Raleigh, North Carolina, and Philadelphia. Go to jimmydoorecomedy.com for a link for all tickets and become a premium member to get access to all our premium videos.